Frederick syndrome combines two serious arrhythmias. What exactly is it, and what's the interesting history behind its discovery?
Frederick syndrome is the simultaneous occurrence of two distinct and serious cardiac arrhythmias, atrial fibrillation, or atrial flutter, and a complete heart block. It's a rare syndrome, first described by Leon Frederick way back in 1904. He actually did experiments on animal models, showing that by damaging the His bundle, a key part of the conduction system, the ventricles could beat normally while the atria fibrillated. This clearly indicated a severe impairment in conduction from the atria to the ventricles, leading to this unique pattern where the top and bottom chambers beat independently.
What causes it, and what do patients experience? It sounds like a very dangerous combination.
It is a very serious combination. Frederick syndrome is usually caused by underlying structural heart diseases. These can include cardiomyopathy, myocarditis, or even an acute coronary syndrome with ST elevation. Patients often have a prior diagnosis of atrial fibrillation. Initially, if their heart rate is still okay, maybe above 60, they might only have typical AFib symptoms like palpitations, chest pain, fatigue, shortness of breath. However, once the complete heart block fully sets in and their heart rate drops dramatically, often to a very slow 20 to 30 beats per minute, their condition deteriorates rapidly. This profound slowness can lead to severe symptoms like dizziness, syncope, and carries a significant risk of a systole where the heart stops, and death. How does the ECG show this unique simultaneous combination? What would we actually see on the tracing? The ECG is indeed diagnostic and reveals this unique combination very clearly. You'll see the characteristic atrial fibrillation F waves, indicating chaotic atrial activity, or the more organized atrial flutter waves. Crucially, alongside these atrial rhythms, you'll see clear evidence of a complete heart block with AV dissociation. This means the atria and ventricles are beating independently, completely uncoordinated. The ventricular rhythm, coming from lower down, is usually very slow and regular. Beyond the ECG, echo typically shows biatrial enlargement, septum hypertrophy, and decreased ejection fraction. Cardiac MRI is often used to find the underlying cause.
What are the absolute ECG criteria for Frederick syndrome?
The gold standard is the ECG. The key criteria are, first, absent P waves replaced by the presence of atrial fibrillation F waves, or atrial flutter waves. And second, a third-degree AV block, characterized by clear AV dissociation, no electrical communication between atria and ventricles. It's the co-occurrence of these two distinct and severe rhythm abnormalities.
What's the prognosis for this rare and complex condition?
Frederick syndrome is considered underdiagnosed and underreported, so its full prognosis isn't completely known due to lack of extensive data. However, it is recognized to carry high morbidity. If the underlying cause, often a structural heart disease, isn't found and addressed, the prognosis can unfortunately be quite poor. Early recognition and treatment are paramount.